This is Felicia Hopkins with the Harford County Health Department, the Minority Health Program. And this is my coworker,
Michelle Peterson.
We are glad to have each and every one of you listening to us today. Listen, it's been a long time since we've been on doing our Bible Review broadcast. And as most of you know, it is Minority Health Month for our minority men. With that being said, you know that these broadcasts, let's talk about it, focus on health disparities and public health issues that plague Harford County. So please share this broadcast. We're going to have some very exciting guests on today. We have one of our resident doctors that come on to talk about health. It's Dr. Philip Holstead. And we're going to be introducing another special guest, our new co-host. So stay tuned for that. In the midst of our broadcasting, we want to make sure that this information is getting to as many people as we can possibly get. So if you're on right now, please share the broadcast. Please be engaged, ask questions. This is your show. This is a show just for you. So any questions that you might have regarding men's health, please put it inside the chat and we'll be glad to answer those questions. In advance of that, what is this week, Michelle? Michelle's like, I don't remember.
I'm like,
Sunday.
No.
What's Sunday?
What is that? Oh, Juneteenth.
It's Juneteenth this weekend. We're celebrating Juneteenth. There'll be some announcements about that you'll look on our page. You can follow us at the Hosanna School. There are also going to be some other great places to celebrate Juneteenth. But also Sunday is Father's Day. So in advance, we want to wish all of our fathers, grandfathers, pastors, everyone like a father. We want to wish you a happy Father's Day in advance from the Harford County Health Department and, of course, the Minority Health Program. So without further ado, I'm very excited. We are growing, Michelle. We are growing.
Yep.
And we have, as one of the social determinants of health, there's about 5 or 6 of them, depending on what kind of aspect that you look it up under. There is like social support, discrimination, there's healthcare determination. These are things that help us as a community. It lets us know whether you're faring well or the different support systems that you might need to help you along the way. One of those things is faith. And along those lines, we always want to make sure that we are covering all of our bases. We are growing. So we want to thank all of our listeners for growing with us. With that being said, we have a new co-host. And I call him, and most people know him as the People's Bishop. That is Bishop and Pastor Irvin Schofield. And I'm going to bring him on right now. He is the pastor. Hello, Bishop Schofield.
Hello, everybody.
Hello.
He is the pastor of Infusion Church in Abingdon, Maryland. And I'm just going to ask him just to introduce himself, where he's been, and just welcome you all. Welcome.
Yeah. Thank you so much, Felicia, for that warm welcome. Thank you also, Michelle. I am beyond excited to be a part of this initiative and a part of this team with the great work that you're doing in Harford County. And to add the faith element, it's such a joy and a privilege for me to be considered. As Felicia mentioned, I pastor a local church in Harford County, Infusion Church. I'm very proud to pastor that church, and I would stop short of calling it the best church in Harford County only because I do not want to promote competition when the community can better participate or benefit from our collective unity. So I'm excited about
Mhm.
Infusion Church and serving. I don't just pastor the church in the Harford County area, I'm actually a resident of the Harford County area. So that's a double benefit for me. In addition to that, I am a Maryland licensed realtor. So I'm a member of the Greater Baltimore Board of Realtors, the Maryland Association of Realtors, as well as the National Association of Realtors. And I'm just excited to be here to add to the faith component, to make sure that we understand that beyond what we do with our bodies to support our healthy growth and development, that we also provide the right attention to our soul in regards to our meditation and our prayer, to make sure that those things work together to make us a holistic being. So thank you, Felicia and Michelle. I'm excited to be a part, and I'm looking forward to get going.
Thank you so much, Pastor
Thank you.
Schofield. I want to just reiterate that there are so many different factors that help make a body whole in the community that you live, play, and work at. And faith is one of them. And so, with that in mind, we're thankful for the Harford County Health Department being able to embrace that factor wholeheartedly and allow us to partner with Infusion Church. Partnering is vital. And so I'm so thankful for Pastor Schofield and Infusion Church being that community partner and stepping up to the plate to be able to support us in our activities, our monthly activities in Edgewood, Joppa, Aberdeen, and Havre de Grace. And also, we are glad to have you lend your voice to all of our discussions going forward. And so, without further ado, we want to jump right into our discussion. This is someone that is not foreign to the Harford County Health Department. He has availed himself on many occasions with his expertise as a doctor, a medical doctor in the field of health. And we're so glad to have him to be a part of this discussion. And that is Dr. Philip Halstead.
Hello.
Good evening, everyone. Glad
Hello.
to be here.
Good evening.
Nice to
We
see
are so
everybody.
glad to have you. And before, I'm going to turn my music off a little bit, but before we start jumping into our topic of discussion, let us to you about more about who you are and what you do to remind the community the type of partner you are here for us.
Yes. Well, first of all, I just want to say I'm very excited, just as Bishop Schofield is, to be here because I really like the underpinnings and appreciate the underpinnings of the show, and that it takes a holistic attitude and also does not neglect the spiritual aspect, as well as combining it with the physical aspect as well. And these are all very, very vital. I served as an integrative medicine physician in Harford County for over 31 years. Just kind of using the best of both methods, the best of conventional medicine and the best of holistic medicine, and combine them together to really achieve optimal health for my patients. And recently transitioned over to health coaching, which has kind of a whole different kind of bent to it, but it's a bent that I really appreciate because I can actually spend more time with people in regards to their health than I could as a full-time physician, and also get people to understand that they are more in control of their health than anyone else. And that's very important. I think going forward, I think 21st century medicine is really going to be about that. It's going to be about people learning how to empower themselves and how to get knowledge and be able to really take control of what it is that they want in terms of their health. And as a health coach, I walk side by side with people to help them to do that. So that's why I'm really excited about the future of medicine, period, and the future of going forward with the Harford County Health Department as well. So I'm glad to be here. Thank you.
Thank you so much, Dr. Halstead. I'm excited about our future partnership together, and this being focusing on minority men's health. As a side note, I think every month Michelle and I have learned that the Harford County Health Department has focused on something new that is highlighted for that month. I think
Every
we have
month.
women's health.
Yep.
I
Every
mean, they
month.
focus on so many different aspects, which I think is fantastic. And
Mhm.
also, this is just to bring awareness to the topic of men's health. Um, I know personally that a lot of minority men might not always focus on their health. Um, Michelle, you were able to look up some information that we thought was maybe it was because we people weren't insured, that they weren't making enough appointments. But Michelle, just share with us what you found.
And being them not being insured is not the case. They have said over 95% of Harford County has medical insurance. So it just seems to be that some folks are just not using their insurance. Maybe they don't know where to go. Maybe they haven't used it because, in most cases, we know, especially for men, they have to be feeling really bad before they go to the doctor. They were, raised to be strong, not cry, so they tough it out through a lot of situations. So that could be the case. They're waiting for it to be bad before they actually go get some help, which is not good.
So, Pastor Schofield, I have a question for you.
Sure.
Before we go to Dr. Halstead, um, Pastor Schofield was recently, if you don't mind me sharing, was recently in the ER. And if you can just share a little bit about that and what brought you there.
Yes. On Friday morning, I went to the ER because that evening before I started having chest pains. And those pains kind of lingered with me throughout the night. And in the morning, I thought that it would be wise to go and get that checked out. Now, I've been to the hospital a few times before in the last 20 years or so for chest pains, but my test always came out great. I have a strong heart. But you can never be too sure about these things. And so you go and get checked out. I spent a good amount of time there because obviously when you go, they want to make sure that they look at everything to ensure that there are no issues. I had a key EKG, I had an x-ray, they took some blood and they tested the blood as well as, blood pressure and so forth. It turns out my heart was good. But what triggered me was stress. And so, even though stress sounds like a better situation to have than a real heart situation, we all know that stress can lead to some very serious complications. And so, yes, I ended up in the emergency room for several hours. And I'm glad I went. In times past, I might have been reluctant to go, but we've got to be real mindful and, take responsibility to act when the body is trying to communicate to us.
Absolutely. And so thank you for sharing that, Pastor Schofield. And I'm hoping that our men that are listening and those that are related or have men or young men in their family can listen to some of what we're saying today and take your health very seriously. So, Dr. Holstead, my first question for you is how often should we be visiting our primary care physician?
Well, Felicia, that varies, okay, from person to person. It really depends on what the health status of that individual is. Certainly, if someone really has been healthy and doesn't really have specific medical problems and is doing well, usually once a year is fine for a physical. The thing is, if they have that physical and things are found, like say blood pressure is elevated or sugar's elevated, cholesterol is elevated, that's going to kind of change the whole dynamic there. Those sorts of people will have to be followed up more frequently because they end up being treated for a condition that needs to be monitored. Okay, so it may be that they need to be seen every month for a while until things level out. Like say if someone is a newly diagnosed diabetic, they may need to go to their doctor every 3-4 weeks or so while they find out the proper dose of medication to give that individual. Then as they stabilize, the visits can be stretched out. So it really depends on what the health of that individual is. If anything has been found, certainly no health problems once a year is fine. But if there are specific health problems, then they really need to follow the recommendation of their physician and get followed up as frequently as possible in order to get that specific medical condition under control.
Well, thank you for that. I'm thinking that we're having some connectivity problems. I can hear you, and if everyone else can hear you, please let me know.
Yeah,
Yes.
we can hear him and see him.
Mhm. Yep. Yes. Hopefully you can hear us as well.
Okay,
Yes.
I can. I was
Okay.
just having some brief connectivity
Sure.
issues there, but Dr. Hall said if you can just reiterate, is it proper to go at least once a year, or did you say
Yes,
once a
absolutely.
year?
Yeah, absolutely. Once a year, if you have no specific health issues. If you do have more specific health issues like
Thank
diabetes or blood
you.
pressure or cholesterol,
And
then you need to go a little more frequently, according to how often the doctor needs to see.
and while we fix that particular technological technicality, we are going to give a few announcements, a few community announcements while we have your undivided attention. And so I'm going to bring on Michelle Peterson, and she is going to give you some of our community announcements while we pull back up our stream. Hey, Michelle.
Hello. All right. So tomorrow, Tuesday, June 14th, the Village at Lakeview will be having a food giveaway, and that will be at between 11 to 1 at 833 Fisherman's Lane, and that's in Edgewood, Maryland, 21040. And then June 25th, they're going to have a community family fun day. It's called Summer Jam. I like the name of that. That'll be Saturday, June 25th. It'll be family food and fun, carnival style games and prizes. Looks like it's going to be a lot of fun. So try to get there if you can. And then, of course, on the 30th, Felicia and I will be partnering with the Edgewood Parks and Recreation with a focus on a family field day that is going to be on Thursday, June 30th, from 6:30 to 7:30. You don't want to miss it because we're going to be playing a friendly game of bubble soccer, and we're going to have the human-sized hamster balls, and it's going to be right at Cunyon Field, right across the street from Kohl's Warehouse. We will have some snacks, some special announcements and resources to give to all the families. So bring your whole family if you could. And that address is 1702 Trimble Road in Edgewood. I know people always say across from Kohl's, so we gave you an exact address. So we'll see you there. All right. Did we get this fixed yet, Felicia? Should I keep going? All right, so we'll just need a few more minutes to get this next video going. This next clip, sorry.
Yes. So Dr. Halstead, in your experience and tenure, and looking at it in the current day and time, what do you say is the top health concern for men currently?
Well, Bishop, I think the top health concern for men, period, is ambivalence. It's not a specific disease process. It's actually an attitude that's the problem, okay, that we have to really be able to overcome. And that attitude of indifference, that's ambivalence, just means indifference, just not really caring specifically about, what happens.
Mhm.
But what we have to do is really try to reiterate to men that, one, men are valuable to society, because I think sometimes the way society, especially for the Black male, is structured is that we get demeaned and our value gets diminished. And we start thinking less of ourselves and thinking that we're less important than anyone else. Being low man on the totem pole, but that certainly is not the case. We are just as viable and just as important and needed as anybody else. So once we get that into our heads and realize that we need to preserve our health and take care of ourselves so we can be all that we can be for our families and our communities and our churches and whatever else we find ourselves in, then I think we actually have made a big stride. If we do that, we can make a big stride in terms of men being more conscientious about maintaining their health and taking better care of themselves. So if we can overcome that indifference, I think that's the biggest issue. That's the biggest obstacle.
Wow.
That's very good. That's very good. And I certainly can see how that would benefit a lot of us, as we move forward, because I would have said, and I fit in that category or did fit in that category, not really focusing on it. And oftentimes I wondered to myself, do I not care, or do I have competing priorities in the sense of, for example, it could feel so competitive for men at times, to take time away from something that you deem provides your income, maybe losing track with accomplishing your goals, maybe losing money in the process of trying to tend to those things that are important. Sometimes we get thrown off in our priority, it gets skewed in that process. So, coupled with what you're saying, I think we have to, and you really did hit on this when you said we have to see ourselves as valuable, because if
Wow.
we can see ourselves as valuable and put it with with what you said about caring about our health, I think that would take us a long way. So I'm really glad to hear you address that as opposed to a specific medical situation, because I think you hit the nail on the head.
Yeah, part of all of this is just really getting down to the root causes of things. You start talking about specific disease states, you overlook that ambivalence part. But we've got to get the shovel and dig down into the dirt, and that's where the ambivalence is, and that's what we need to dig up and get rid of.
Great.
Absolutely. That's huge.
Definitely.
And I know that you have some more questions, Pastor Schofield.
Oh, I get to ask another question?
Yes,
All
you
right.
do. We have some
Great.
too, but we want to be
Okay.
able to share the love.
Sounds good to me. Yes. It's good when men can ask the doctor, questions, right? Because
Absolutely.
obviously, we really need to be having this conversation more. So great. I have a question about the prostate exam, because, I often share this story. People many years ago, I was about to take a trip to Africa, and I went to get a physical when I was, prepared to Africa. And the guy did the physical, everything was good. And he says, okay, you're good to go. And I asked, I said, what about that prostate exam I kept hearing about? Why don't I get that done while I'm here too? Now, I think I was like 40 or maybe close to 40. I don't know the exact age. I wasn't specifically at the age where it was recommended. And so he says, yeah, I guess we could do that, if you'd like to get that done. I said, yeah, let's go ahead and get that done. And then the guy began to put on gloves, and I'm like, what's that for? I had no idea what the prostate exam was. And I'm embarrassed to say, but it took me another 10 years before I tried to get another prostate exam. So my question is, and I think other guys might want to know this too, are there alternatives to the standard prostate exam? And if so, would you recommend them?
That's a very good question. And it's a funny story that you have, but it's a very common story that men have. Now, the whole idea with it's called a digital rectal exam, the DRE. Okay. And that years ago was really the gold standard for checking the prostate. But now, as of recently, it's actually thought of as more of a secondary type test, because you can still miss prostate cancer even with the DRE. So the focus now is really more on getting the PSA test done, the prostate specific antigen, which is a blood test. I personally feel that a combination of doing the DRE and the PSA is really the best defense, the best way to really minimize any possibility of missing prostate cancer. There are other tests too that are being used as well, something called a free PSA, or percent of free PSA. And what that PSA is, an antigen that's either bound to protein in the bloodstream or it's not. So what they have found is that there's a link between the percentage of bound PSA and the possibility of prostate cancer. So the higher or the lower your percentage of free PSA flowing through your bloodstream, the higher your risk of cancer, and the higher your percentage of PSA, the lower your risk of cancer. So there's actually more tests now out that are actually more specific for detecting prostate cancer. There's also a test called PCA3 antigen, which measures different chemicals and different substances in the body. And if that PCA3 is elevated, that can also point more towards prostate. So the DRE, the digital rectal exam, is starting to somewhat fall out of favor, but I still think it's a useful test. But I think it should be done in combination with at least a PSA test. For men between the ages of 50 and 70, a PSA of 2.5 or less is considered normal. For men over 70, they can deal with a PSA of 3.5 or less as being normal. But out of those ranges, it really becomes more of a higher possibility that they may have prostate cancer. So that PSA test is very important. The rectal exam, right now they're looking at more of it as a secondary test, but the PSA test is definitely a critically important one that's being used more frequently for that. So you can, in some instances, get away without the digital rectal exam. Personally, I think that you doing both, I think, is the best way to potentially decrease the risk even more exponentially of prostate cancer than doing one without the other.
That's good news, because if there are any men out there listening and you were like me, staying away from the doctor because of your eye-opening experience, we have alternatives and options. But if you need some additional encouragement, if you talk to people who have found out they have prostate cancer in the process of their journey to recovery or trying to overcome it, I'm sure you would be encouraged that we need to do whatever we can to address our health by any means necessary. So thanks so much, Doctor, for that. I appreciate it.
You're very welcome.
Absolutely. This is becoming a very good conversation. The top 4 health issues that affect minority men, not just in Harford County, but in general, are cancer being number 1, cardiovascular disease being number 2, diabetes being number 3, and violence prevention being number 4. So I told Dr. Halstead in our travels, we'll have to circle back around to having just a whole show for violence prevention, because that is very prevalent today. But Dr. Halstead, if you can answer another question for us, what other encouraging words besides our personal testimonies? I know that for my husband, Ben, I would, and you know this personally, I would schedule his appointments.
Yeah.
And not only schedule his appointments, but I would send him there with a list of things to make sure that he talked about when he got there, because he would come back and be like, oh, everything was fine. And, well, did you tell him that about this? No. Did you mention you were having some problems? No. So I would send him with a list. So what are other things, I don't know, besides sending your husband or significant other there with a list, can we do to encourage proper care when they get to the doctors, letting them know, this is not, it's a personal conversation between you and your doctor. You go there to tell them everything. I'm assuming that's what we do.
Oh yeah, that's the way it should be. But of course, it's not always that way. I mean, I think part of the problem is just that whole stigma of men just being strong and tough, and not saying that there's anything wrong and all this sort of thing. So we have to really address that issue, and this just pound home the point that is actually counterproductive. Seeking the help of a healthcare professional is actually a strong thing to do. It's not a sign of weakness.
Yes.
It's a sign of strength. Okay, because it shows that you care enough about yourself. You've got enough, self-respect and regard for yourself, that you know that you are important, that you need to be here, you need to be healthy to take care of those around you. And so I think if we kind of really support men in that sense, just that, again, like we talked about, their value, just that they are viable and they're valuable, and that they're needed. And just because you get checked out doesn't mean that there's going to be something wrong. But the thing is, if there is something wrong, you're much better off knowing about it than not knowing about it, because not knowing about it doesn't make it go away. Okay.
Yes.
Just prolongs the time before it gets addressed, becomes more of a problem. And then, it's like I always say, it's better to keep the horse in the barn than to try to catch him after he's loose. So even if everything is fine, that's a great thing, because for one thing, it's very encouraging to the man that he knows that things are fine, and that he knows that he can, if he continues to do right things about his health, like exercise and diet, things like that, that he can keep himself that way. But then on the other hand, if something is found that's not right, then it can be addressed and it can be fixed. Things can't be fixed if we don't know about them. Right. So we just have to kind of just pound that home, and that, there's no loss of dignity. There's no wimpiness about going to see a doctor. In fact, it shows you that you're a tough guy. You're strong enough and you're sensible enough to be able to want to go and take care of your health. And that's actually a positive thing.
Yeah.
Absolutely.
It's interesting when I think about how I lost my dad, right? My dad lived to be 84 years old. So he lived a good age. But when I think about the circumstances around his passing, I realized that he shortchanged himself by a number of years. And I'll tell you why, because my dad went to the pharmacy to refill his blood pressure medicine. And when he went, they told him, well, I'm sorry, we can't refill it, because after a certain amount of refills, we have to require you to go back to your physician in order to, start that process again. And so I suppose my dad felt like, since he found something that worked, that kept him from the doctor's office, he didn't want to go back. Apparently, my dad was so upset that somebody was telling him he couldn't get medicine unless he went back to the doctor. He decided not to take medicine anymore. And so we lost my dad probably within a year, maybe less time than that, because this whole, I don't know what to call it. I know there's some stubbornness in there, but we have to be mindful that when people have these rules in place, there's a reason for those rules being in place. And it's for our good. And we can't be strong-willed, regarding, our health, because it is important. And I really feel like I would have had my dad around a little longer, had it not been for that perspective around, the pharmacy's requirement for him to circle back with his physician.
Yeah. And that's actually just a built-in safety mechanism when they do that, saying that after a certain number of refills, you can get a certain number of refills and then you have to revisit your doctor. It's actually a safety measure for the patient, because it's a way that the doctor is guaranteed to see the patient again to make sure that medication is still effective and that something doesn't need to be changed or added. So it's actually something that's not put there to aggravate the patient, is there to protect the patient.
Right.
It's like more of a reminder, kind of like, okay, time to go back and see your doctor and see if anything's new happening or what's going on is still working. Yeah, that's good. Because they say 1 in 4 men have some form of heart disease, right? And a lot of individuals don't realize that they can have no symptoms for years. Meanwhile, internally, their body is going through those changes, and then one day they wake up in pain, and by then it's too late. And just to tell a quick story, my best friend lost her husband that way because he had high blood pressure, went to the hospital, they gave him medication, and he wasn't taking it. I guess he felt like he was too young, he didn't have to deal with that stuff. And he went for so long without taking medication that his heart was working harder and his aorta cracked.
Mm.
So
Oh,
now
yeah.
by this time, there's nothing they can do but a heart transplant, which, long list, you can't really get a new heart that easy.
Mhm.
And he was only like in his early 40s.
Wow.
Wow.
So a lot of people don't realize, they feel like, oh, I feel great. They wake up every morning, oh, I feel great, I feel strong. But your body doesn't give you a signal until it's like not functioning. It's just like batteries. They work until they don't work more. Like how the remote, you can hit the back of the remote and sometimes it'll start juicing up again. It's the same
Right.
thing. You don't really realize that something's going on wrong internally until it's like, okay, I can't take anymore. And now it can be too late. So it's good that men get seen, at least, like you said, Dr. Halstead, once a year.
Mhm.
Mhm.
Once a year.
And get that blood work done.
And get that
Yes.
blood work done. Yep.
Yes.
Yep.
There's
Absolutely.
just so many things that you can't see, and you can't see, you can't
Absolutely.
feel, but they can still be kind of brewing under the cover, unseen. And
Yep.
that's where those tests really come in handy, because there's no way you're not going to feel a certain way if your cholesterol is elevated. I mean, it doesn't have symptoms, but
Right.
it's an issue that if your cholesterol is 500, you're not going to feel anything. You're not going to know it's there unless you actually get the blood test to get it checked.
Right. And then some people don't realize that them feeling ill becomes their new normal. I've
Mm-hmm.
had people tell me, as a community health worker, when I used to do home visits, they would say, "Oh, when my blood sugar is 500 and something, I feel great. When I start taking that medication, I feel bad." And I'm like, "How is that?" It's because your body got so used to being sick and abnormal that you were functioning properly, but now that it's trying to do its thing and fix itself, now you're feeling bad. You're saying that the medication is not doing that but making you feel sick.
Yeah.
Wow.
Yeah.
Yeah.
That's
So
common.
that
That happens
These
commonly.
these are all things. I mean, I hope, really listening to what is being said here. I think that we have mentioned a lot of barriers, and hopefully we're able to address some of those barriers by letting you know that you are not only valuable, you're important to whoever is in your life. You're important to even if you are a single man, you're important, you're valuable, your life matters. And sometimes they say, well, maybe, just as Bishop Schofield mentioned, I'm going to miss time off of work. You're going to miss more time if you're ill.
Mm-hmm.
Yep.
And then, one of the other things that we didn't address is that ongoing trauma, that ongoing unspoken trauma that our bodies go through, that it is so important for us to continue to take care of ourselves. You're worth it. And I don't think that as minorities, we hear that enough.
Mm-hmm.
And I don't think that our men hear that enough, that we love you, we care about you, we want you to take care of your bodies. We want you to take care of your health. We are here to support you. Um, there are so many different resources that are available, not only through the Harford County Health Department, but our partners with Upper Chesapeake Medical Health Center. They have a full diabetes program. And if you need access to that, you can reach out to Michelle and I. We will get you the information if it's not already on our Facebook page, our web page, which you can see down here at the bottom of the screen. Um, I know that we might have a few other questions. I want to get them all in because the questions that I looked over were very important. And we want to make sure that we don't shortchange anyone with information. So I think that, Bishop, you had another question as well.
Oh, sure, sure. So, um, this particular question here, really speaks to how, or at least it asks for some insight as to how our faith communities can better assist our medical professionals when working with our men. Oftentimes we have the opportunity across our pulpits to speak to people and encourage them. One of the things I always used to say is good humanity as credibility to spirituality. And basically the whole concept there is to help people understand that we can't be just thinking, spiritual and not think about the holistic human aspect. God created us human because he wanted human. And so that humanity piece is important. And so I'm wondering, if besides us encouraging men as best we do, and I really don't know that we do enough of it, but what would you say, the faith partners, pastors can do in addition to maybe speaking across the pulpit to encourage men to take their health seriously? Any thoughts on that?
Well, I think it's always helpful sometimes to have even just outside speakers come in, maybe people that aren't really familiar with your congregation, that are just new, because sometimes you kind of get a deaf ear to people that you hear over and over again. So sometimes doing that would definitely help. But I think the whole thing, again, I think it's just reiterating just the fact that, again, the spiritual aspect of our lives is very important. But, everybody always talks about the scripture that exercise profiteth little, that sort of thing, or physical. People use that as kind of an excuse not to exercise, but profiting little doesn't mean not profiting at all. Okay, so we have to take care of ourselves physically, because as we feel physically, that's going to impact how we feel spiritually. Okay, it's going to affect how well we pray. It's going to affect whether we're motivated to read our word. It's going to affect we can healthy enough to go on fast and things like that. So God's looking for the whole package. He's not just looking for spiritual giants. He's looking for healthy spiritual giants. Okay, physically healthy spiritual giants.
That's right.
So you have to you really have to just always go back. You can never go wrong by going back to that holistic viewpoint, that we're not just one facet. Okay, we're triune beings with body, mind, and spirit. Okay, and all three of those, any one can affect the other two if it's not working right. Okay, and that's true for all that. So we have to really never minimize the importance of taking care of ourselves, doing what we should do properly, and whatever's in our power to do that, and not be afraid to make changes. If we've been doing things, eating poor diets for a long time, don't be afraid to change. Don't be afraid to try to start making some changes there. Very, very important.
Absolutely.
And, it's not, nobody's asking anybody to make wholesale changes at one time. You can just work on one change at a time, just work on something as simple as drinking more water. You can start doing that, drinking half your body weight in ounces every day. Then once you get to that, start trying to, move into some more, healthy fruits and vegetables, things like that. But just making just small changes on a consistent basis is really key. And I think oftentimes people think that they have to change out everything at one time. They try to do too much at once. They get discouraged and they quit, and then they go back to the poor habits again. But just, I think if we stress to them that, obviously your habits, if they're not great, they've been not great for a long time. So to get them right is going to probably take a while to change them, to get them to better habits. So have people understand how important it is to take care of their physical bodies, but also have them be patient with themselves and making small changes as they go along. And then much more likely, I think, to stay with a program of trying to improve their health on that level, if they have that understanding, and that it's not that they have to make full scale changes all at one time.
I like what you said there, if I could, and I'm going to actually put that in practice, where people can get tired of hearing the same voice all the time. And if we can invite, the skilled professionals to talk about their area, and then we can be the backup voice in that aspect, I think that might, really help to communicate from a standpoint of knowledge and competence, and from a support standpoint, being a spiritual leader and influencer in that community to help them going on. But Doc, you said something about, that water thing, like drinking half your body weight. I got on the scale and I had, my weight increased, and I had been struggling drinking water to begin with. So we start to talk about half the body weight, and I'm thinking about having to increase the progress I've already made.
Yes.
I'm going to have to go down on my knees. No, but it's a good thing. And I'm up for it. I'm up for that challenge, because it's something that absolutely needs to happen.
Yeah, that's something that you work up to. It's not, you don't just jump up to, half your body weight in ounces right away, but you work up to it. So, you know, a 200-pound person needs to drink 100 ounces of water a day, but you need to work up to it if you're not used to it. You don't just jump off and do it, but each week just increase the amount that you drink until you get to that. So everything gradual, just everything gradual.
Awesome.
This has been a phenomenal conversation. We're coming up on the half an hour, and I know that we can talk about this a lot longer. I am so thankful for you, Dr. Philip Holstead, for always sharing your time with us. And of course, listen, we have a ticker down here welcoming our new co-host, the People's Bishop, Bishop Erwin Schofield, and my co-worker. Listen, if you have questions regarding anything that we're talking about today, please put it inside of the comments. Yes, this particular segment is being recorded, but we do look back on this as well as we're live, and we will answer your questions. So we're going to move on to our next segment, and before that, we're going to have a commercial break.
This dude comes to thoroughly entertain you, and he does it his own unique way.
How do we keep walking into each day?
Certainly something to be said when you get sent a record like, you know, with Chris Calico, and Chris has that I gotta try to compete with that.
Yeah. So how do we take the first step is the question. Consistently, once I knew it would help me. Talk out loud to myself. I say, you're alive! You are here!
Hey, this is Chris Calico, and I cannot wait until June 18th. I'm coming to Hartford Community College and the annual Youth Leadership Career Summit. It is going to be explosive, man. I might even show you how to get one of these or be anything you want to be. June 18th at Hartford Community College. Cali, baby!
Whoa, whoa, whoa. That's going to be exciting.
It looks exciting.
Yes, and that is the perfect segue into our next segment when we are bringing on InStep. InStep is having a symposium based on that commercial clip that you just saw. We are excited. Hey, Michelle. Hello,
Yes.
Bishop, again. We
Hello.
want to yes, we want to thank Dr. Holstead again in his absence for his time with us addressing minority men's health. But I am going to introduce a special group of women, and it's going to get crowded on this screen, but we're excited to have them. Um, First, we're going to introduce Miss Joyce J. Davis and Miss Carolyn D. Campbell to the screen, and we're going to say hello to them before I bring them on to my next guest.
Hello, hello.
Hello, ladies. How are you?
Good. How are you?
It is so good to have you guys. Before I bring in the director of InStep, could you just share a little bit about who you are?
Go ahead,
We can
Jay.
start with Joyce J. Davis.
Hi, I'm Joyce or J. Davis. I am the secretary for NSTEP, or New Service and Training Employment Program. And I'm an engineering major also. And I work very closely with Carolyn. NSTEP is a 501c3 nonprofit that is headquartered in Havre de Grace, Maryland, and is founded by Sharon Jacobs, who we're going to be seeing in a few minutes. Sharon actually is retired from the Army and served as the Patriot Air Defense Artillery and Acquisition Corps for over 20 years. And NSTEP's focus is on preparing the community's youth and young adults in workforce development initiatives, and primarily works with low-income and minority populations. And the goal is to provide job readiness training, career exploration opportunities, pathways and planning. And some of the services that we offer to do that is tutoring for the GED, ASVABs, mentorship, coaching, and some virtual STEAM like career exploration panels, which we just did our last one in June, and we will be resuming in September. And then I will give Carolyn a little introduction.
Good evening, everyone. My name is Carolyn Campbell. I'm new to InStep. I'm a new volunteer. I retired from the Air Force last October after 33 years. And Sharon felt like I needed something to do, so she pulled me into InStep. And I've been helping plan the conference that we're having this coming weekend. So it's a pleasure to meet all of you.
Carolyn, it is so nice to have you all. And before we delve deeper into this conversation, I'm going to bring in the director woman herself, my community friend, Sharon Jacobs. If she comes back on, we will put her on there. And I know that she is always super busy, but if you all can see at the bottom of our screen, it's the Women in STEM. Why? And you might ask, why? This is the Harford County Health Department Minority Health Program. But if you are familiar with some of the social determinants of health, one of those is education. And making sure that our young people are properly educated and that they have resources such as a STEM symposium where they can get to and be able to absorb that information. That helps. That helps, academically. It helps with your mental health. It helps with a whole lot of different aspects. And so we are glad to have you. And I think that we've got Sharon on here now. I'm going to pull her in.
Okay. I'm not sure why you can't see me. I can see you guys. Hold on.
Welcome.
Welcome, Sharon.
See, well, hell, I can't see you, but I can see you, but I don't see my picture up, but that's okay.
Well, then, you know what you can do, Sharon? Just as you were talking, I'm going to put up the flyer for the event. And so we can see it, and I will block everybody else off. That is the flyer. This is the motivational speaker, as you saw the video clip. I might pronounce his name wrong, so you guys jump in there. Is this Chris Calico?
That is correct. Chris Calico.
Oh, good. Chris Calico. And he is going to be their guest speaker for this coming Friday. This coming Friday from 8 to 4 p.m. at the Harford County Community College. So ladies, please explain to me what will happen on Friday, and then we can talk about what will happen on Saturday as well.
Okay. Yes. So, Felicia, thank you so much for inviting InStep to be a part of this podcast. We really appreciate your time and opportunity to speak. We are hosting this week, as you heard Jay say, we are hosting a cybersecurity symposium and career expo on Friday and Saturday, June 17th and 18th at Harford Community College. On June the 17th is the date where we will have a professional facilitate discussions on the cybersecurity career field. We have many guests from the Aberdeen Proving Ground community, our defense industry partners, and from the community college and our public schools who will be supporting our two panels. One is on education requirements, and the other is on workforce requirements and where the jobs are. So as you heard Jay say, our mission is to align you with jobs, help our young people find those career opportunities that they may have not considered, but help provide that information to them. And then on June the 18th, we are going to do it live with Mr. Chris Calico. He is coming all the way from Kansas City, I believe. and he
Wow.
will be doing a motivational speech on how he overcame his obstacles of bullying and the
Mm.
difficulties that he went through because of vitiligo, and to become the person that he is. So he is going to speak with our youth about designing and defining your destiny.
Wow. Sharon, as all the years I've known you, and you've put on these wonderful symposiums, they have been phenomenal. And so I want the listening audience to please take note of the information that is being given and attend. So could you let them know how they can get tickets? I'm going to pull that up, and how much the tickets are.
Yes, thank you. So for students, if you are in high school, middle school, or college, your tickets are free. We have about 50 free tickets left for students. We have sponsors who paid for students to attend. You just need to go to www.nstepforward.com, the letter N, STEP, forward.com, and you can go online there, click on our link, and register for your tickets in that venue. For adults who are attending, if you're attending both full days for the symposium, the cost is $40. If you're attending only one day, the cost is $25. And we would ask that you send us an email at the instepcoordinator@gmail.com for any additional details you may need to get the promo codes for registering.
That is fantastic. I want this message to go out to all the adults listening. Um, we often talk about the fact that there are not enough resources or where they are. We want to be that bridge into the community to allow you to make some very good choices to take your children to. I know that my children are older. My youngest is 13. She will be there. And you don't know who you're going to meet. You don't know who you're going to see. And we can't just assume our children just want to be in sports. This is STEM. This is another aspect of life that we need to expose our children to. So if there are any other I want to engage in
Let me
conversation. So
let me
go ahead and
ask
jump in,
this.
Bishop.
And I may have missed it when my video feed was on the blink. Did we specify, or was it said how young? I mean, what is the age range? Who are you looking for in terms of the youngest, participant?
So we are looking primarily for middle school up through as the youngest participants for the program on the 17th, and
Mhm.
then as well as on the 18th as well.
Okay, great. But the adults can attend the 18th. Is that what my understanding?
They can attend both days, yes.
Oh,
So on the 18th, what we will have out are various displays, exhibits and displays. We'll have vendor tables. Our displays consist of, like we said, different career opportunities. We have a drone instructor from the
wow.
DWS Drone School out of Wilmington, Delaware, who will be doing drone presentations on entrepreneurship, on how to find opportunities of employment with drones. We have the Patriots Training Technology Center out of the Washington D.C. area, who will have
Mhm.
a gaming room set up to discuss. Hey, this is how you become a gamer. This is how you make money in this industry.
Wow.
We also have Eagle Force Health Associates coming down to talk about obstetric simulation and how in the medical career field
Wow.
you can make money in that field doing medical simulations and becoming a medical professional. Harvard Community College will also come to us with a 3D printing table and exhibits on how to learn about 3D printing. We have colleges that are supporting us to talk about college admissions. So we're not trying to leave anyone out or anything out. There are just many avenues that we need to know about and research, and we are grateful for all our sponsors and vendors that are supporting us. We have over 30 vendors who have said, yes, we will support you with getting this information out through our community. So we are really blessed and grateful to have them in support of what we're trying to do in our community.
This
That
is really awesome. I mean, I don't know if you guys saw me perk up when you talked about that drone program. Um, I,
yes.
I've purchased the drone. I actually have it in my little display case. Um, it's a nice drone. I
Okay.
haven't flown it yet because I'm still trying to learn it, you know. But that sounds awesome, especially, and I believe young people would be particularly interested in all of these, wonderful ways where they can find careers and use their talents. And it's not just your typical traditional things that were in place many years ago. So I think this is going to be awesome for young people and old alike.
Bishop, if I can just put another plug in, all of Sharon's events are phenomenal. I've been there. I've had my our nonprofit volunteers participate, and it is fantastic. I wouldn't sleep on this event. I would attend. If you have any middle schoolers out there that are interested in STEM, and is it high schoolers too, Sharon, or
Yes,
my overstepping?
And
High
college.
schoolers as well,
in college.
college students as well. Please take your time to come out June 18th and 19th and participate. Again, thank you all so much. If there's anything else you wanted to add to your programs ongoing outside of this particular event, please share it with us at this time.
I just want to say again, Felicia, thank you for the opportunity to allow us to present our program to your community today on the podcast. We are humbled and we are excited about what we're doing as a team of volunteers in our community and the information that we can bring to our students and our communities at large. So, everybody come out. It's going to be fun, learning, and educational. You will get to meet and connect with those employers of the future that you may need to know about. And I want to give one last shout out to the leading
Yes.
lady, and I call her the leading lady of Harford County, Miss Claudine Adams, who is the CEO for Bravera Information Technology Systems. She is our lead sponsor for this event, and we
Wow.
could not have done this without her company and their support behind us.
That's
Absolutely. I
awesome.
am so happy to just know you and InStep and your wonderful team. It's going to be a great event. I'm looking forward to it. And I think that we are at the end of our programming. If there's, as we say in church, if all hearts and minds are clear, we have come to the end of another segment of Let's Talk About It, and we are just thankful for your community involvement, and we look forward to it. So, ladies, thank you so much, and Michelle and Bishop Schofield, hang on for just a second as I dismiss our wonderful ladies. Thank
Nice
you.
meeting
Thank
you all.
you.
Thank you. Great to meet
Bye.
you.
Thank you.
I want to, before we end, I did not, since we haven't been on in a while, I was not able to play the clip from our mental health awareness month when we did the men's lock-in, and that was May 20th. I want to thank you, Bishop Schofield. That right there sparked an interest in all of us to say, from the Harford County Health Department, we need him on board with us. We
Oh,
need him to come and be a part of what we're doing. And before we um, close, we want to give the community a small clip of what that experience was. We're going to have one for the young ladies in October, so stay tuned, save the date. Um, we are going to have it again at the Aberdeen Epic Center with our team, and we are super excited about that. And so, without further ado, I'm going to play this clip, and I'm going to pull you all off the screen. Thank you so much.
thank you.
I think we're having some technical difficulties with that particular um, video clip, but what I will do, I will put it inside of our our chat screen so everybody can take a look at it. But again, thank you all so much and have a good night. This is another end of our segment. Let's talk about it.